Have you ever woken up in the middle of the night with a sharp, burning pain shooting down your leg? Or maybe it's a dull, heavy ache that just won't go away no matter what you do. You try stretching, you try a massage, you even take a painkiller, but nothing really helps. Don't ignore this, what I'm about to tell you could save your life. Because of that pain, it's not always age, it's not just tired muscles. Sometimes it's your body sending a warning that something inside is going wrong quietly. And the scariest part, most people ignore it until it's too late. Picture this, you're lying in bed finally ready to rest. Then suddenly your leg starts aching or cramping or burning, you shift, you rub it, maybe you even get up and walk, it settles then comes back again the next night. Why does it keep coming back? That's the part most people never question. Here's the truth, nighttime leg pain can be a red flag for serious conditions like peripheral neuropathy, deep vein thrombosis, or even peripheral artery disease. These aren't small problems. Left untreated, they can lead to disability or worse. But how do you know if your pain is dangerous? That's where things get scary. Have you ever felt a sharp, burning pain shooting down your leg at night, or a heavy ache that just won't go away no matter what you try? Stretching doesn't fix it. Massage doesn't fix it. Painkillers don't fix it. So what's really causing it? Millions of people over 50 feel this, and most think it's normal. It's not. In this video, I'll reveal the 5 warning signs people ignore and the simple mistakes that make it much worse. The solution for every mistake is explained in detail at the end of the video. Watch the full video so you can improve your living style and enjoy a healthier life. Cause 1: nerve damage, peripheral neuropathy. The first warning is nerve damage, also called peripheral neuropathy. Here's what happens: the nerves in your legs start to deteriorate or become damaged. And when that happens, they send out false signals to your brain. Signals of burning, tingling, numbness, or sharp, stabbing pain, especially at night when you're lying down. Now you might be thinking, why is it worse at night? Great question. During the day, you're moving around, you're distracted. Your brain is busy processing 100 different things. But at night, when everything is quiet and still, those damaged nerves become the loudest thing in your body. That's when you really feel it. And here's what makes this dangerous. Peripheral neuropathy doesn't just cause pain, it can make you lose feeling in your feet. You could step on something sharp and not even know it. You could develop an infection that spirals out of control. I've seen people lose toes, even entire feet, because they didn't realize their nerve damage was getting worse. So what causes nerve damage? The biggest culprit is diabetes. High blood sugar levels over time literally poison your nerves. But it's not just diabetes. Vitamin B12 deficiency, alcohol use, certain medications, and even untreated infections can damage your nerves too. A recent study from 2023 found that nearly 50% of people with diabetes will develop some form of neuropathy in their lifetime, and many of them don't even know they have it until the damage is severe. So if you're feeling burning, tingling, or numbness in your legs at night, especially if you have diabetes or prediabetes, you need to take this seriously. This isn't something that just goes away on its own. Let me tell you about Margaret. She's 64 from Ontario, Canada. For months, Margaret kept waking up with this weird tingling sensation in her feet. She described it as pins and needles, like her feet were falling asleep. But it was also burning, uncomfortable. She mentioned it to her husband a few times, but she never thought it was a big deal. She figured it was just poor circulation or maybe she was sleeping in a bad position. Then one morning, she stepped on a small piece of broken glass in her kitchen. She didn't feel a thing. It wasn't until her husband noticed blood on the floor that she realized what had happened. That moment changed everything for her. She went to her doctor, got tested, and discovered she had developed peripheral neuropathy from prediabetes she didn't even know she had. Today, Margaret is managing her blood sugar, taking B vitamins, and working with a specialist. Her pain has improved, and more importantly, she's preventing further nerve damage. But she told me, "I wish I hadn't waited. I wish I'd taken those warning signs seriously right from the start." And that's the point, your body is always talking to you. The question is, are you listening? Now, nerve damage is serious, but the second warning sign we need to talk about is even more urgent. Because this one, it can kill you in a matter of hours if you ignore it. Cause 2: blood clot, deep vein thrombosis. The second serious warning is a blood clot called deep vein thrombosis, and this one can turn deadly fast. Here, what happens? A clot forms deep inside a vein, usually in your calf or thigh. At first, it may feel like a simple ache, but then something changes. The leg may start to swell, it may feel warm when you touch it, you might notice redness. And the pain, it often shows up at night when your body is still. So why is this so dangerous? Because that clot doesn't always stay there. If it breaks loose, it can travel to your lungs and cause a pulmonary embolism. That means sudden breathlessness, sharp chest pain, a racing heart, and in some cases, death within minutes. Now ask yourself this: is your pain only in one leg? That's a big warning sign most people ignore. Here, what increases your risk? Sitting for long hours, long travel, recent surgery, smoking, obesity, and even certain medications. And yes, just being over 50 raises your risk more than you think. But here's the scary part. Not all clots cause strong symptoms. Some feel mild pain or a small cramp, easy to ignore, easy to delay. And that delay can cost everything. So if your leg is swollen, warm, red, and painful, don't wait, don't sleep it off. Get medical help immediately. Let me ask you something. Do you sit for hours every day, watching TV, working, or scrolling? Because what I'm about to reveal next might shock you even more. The third warning sign doesn't come suddenly. It builds slowly, silently, and by the time most people notice it, the damage is already done. Cause 3: poor blood circulation. Pad. The third serious warning is poor blood circulation, called peripheral artery disease. And this one develops slowly, quietly, until it becomes dangerous. Here, what's happening inside your body? The arteries in your legs start to narrow because of plaque buildup. Less space means less blood flow, and that means your muscles aren't getting enough oxygen. During the day, you may feel cramping when you walk. This is called claudication, but here's what most people don't understand. Why does the pain hit at night? When you lie down, blood flow to your legs becomes even harder. Your heart has to push blood through already narrowed arteries, and that's when the pain becomes stronger, an aching, heavy feeling that won't let you sleep. Some people notice their legs feel cold, others see pale or slightly blue skin. But here's the real danger. PAD isn't just about your legs. If your leg arteries are blocked, there's a high chance your heart and brain arteries are also affected. That means a much higher risk of heart attack or stroke. Let me ask you something. Do you feel leg pain when walking that gets better with rest? That's a warning many people ignore. Take Robert, 58, he loved gardening but his legs started cramping. He rested, ignored it, kept going. Then the pain started waking him at night. When he finally got checked, his arteries were 70% blocked. He was lucky. With treatment, lifestyle changes, and daily walking, he improved, but many people wait too long. So if you smoke, have high blood pressure, diabetes, or high cholesterol, and feel this kind of pain, don't ignore it. Because what comes next is something millions feel, but almost no one understands correctly. Cause 4: sciatica nerve compression. The fourth serious warning is sciatica, which is caused by nerve compression. Your sciatic nerve is the longest nerve in your body. It runs from your lower back down through your hips and buttocks and all the way down each leg. When that nerve gets compressed or irritated, usually by a herniated disc, bone spur, or tight muscles, it causes pain that radiates down your leg. And let me tell you, sciatica pain is no joke. People describe it as sharp, shooting, burning, or like an electric shock running down their leg. It can also cause numbness, tingling, or weakness in the leg or foot. Here's why it's worse at night. When you're lying down, especially in certain positions, the pressure on that nerve can increase. If you're sleeping on your back with your legs straight or on your side without proper support, you're putting even more stress on that already irritated nerve. Now, the good news is that sciatica often improves with time, physical therapy, and the right exercises. But if it's left untreated or if you're doing the wrong things, it can become chronic. And in severe cases, it can lead to permanent nerve damage and loss of function in your leg. So if you're feeling sharp, shooting pain that starts in your lower back and travels down one leg, especially if it's worse when you sit, cough, or sneeze, you're likely dealing with sciatica. Cause 5. Chronic conditions, diabetes or kidney disease. The fifth serious warning is chronic conditions, especially diabetes and kidney disease. We already talked about how diabetes can cause nerve damage, but it can also cause poor circulation, slow wound healing, and increase your risk of infections. All of these can lead to leg pain at night. But here's what many people don't know: kidney disease can also cause severe leg pain. When your kidneys aren't working properly, waste products and excess fluids build up in your blood. This can lead to something called restless leg syndrome, where you have an overwhelming urge to move your legs, especially at night. It can also cause muscle cramps, swelling, and aching pain. And because kidney disease often develops silently without obvious symptoms, many people don't realize they have it until it's advanced. A 2022 study found that nearly 40% of people with chronic kidney disease experience significant leg pain and restless leg syndrome, but most of them attribute it to aging or arthritis instead of kidney problems. So if you have diabetes, high blood pressure, or a family history of kidney disease and you're experiencing leg pain, swelling, or restless legs at night, please get your kidney function checked. Early detection can slow the progression and protect your health. Now, you know the 5 serious warnings, but here's the problem: most people are making critical mistakes that are making their leg pain worse. And one of these mistakes happens every single night without you even realizing it. Let's talk about the biggest mistakes. Mistake 1: ignoring the pain and hoping it goes away. This is the most dangerous one. Pain is your body's alarm system. If it keeps happening, there's a reason. Don't silence the alarm, find out what's causing it. Mistake 2: sleeping in the wrong position. If you're sleeping on your stomach or with your legs straight out or without proper support, you're putting extra pressure on your nerves and blood vessels. This makes pain worse, especially if you have sciatica or circulation problems. Mistake 3: not moving enough during the day. Sitting for hours without moving slows down your circulation, increases your risk of blood clots, and weakens your muscles. Your legs need movement to stay healthy. Mistake 4: self-diagnosing and ignoring medical advice. Google can give you information, but it can't examine you. If your leg pain is persistent, severe, or getting worse, you need to see a healthcare professional. Don't guess, get answers. Mistake 5: taking painkillers without addressing the root cause. Pain medication might give you temporary relief, but it's not solving the problem. You need to understand what's causing the pain so you can treat it properly. So what can you do? Let's talk about real, practical solutions. Solution 1: get a proper diagnosis. If you're experiencing leg pain at night, especially if it's frequent or severe, see your doctor. Get blood tests, check your circulation, check your nerve function, check your kidneys. Knowledge is power. Solution 2: improve your sleeping position. If you have sciatica, try sleeping on your side with a pillow between your knees. This keeps your spine aligned and reduces pressure on the sciatic nerve. If you have circulation problems, try elevating your legs slightly with a pillow under your calves. Solution 3: move more during the day. Even if it's just a 10-minute walk after each meal, get your blood flowing. Movement improves circulation, strengthens muscles, and reduces the risk of blood clots. If you sit a lot, set a timer to stand up and stretch every 30 minutes. Solution 4: manage your blood sugar. If you have diabetes or prediabetes, controlling your blood sugar is critical. This protects your nerves, your blood vessels, and your overall health. Work with your doctor, eat a balanced diet, and monitor your levels regularly. Solution 5: stay hydrated and check your vitamins. Dehydration and vitamin deficiencies, especially B12, magnesium, and potassium, can cause muscle cramps and nerve problems. Drink plenty of water and talk to your doctor about getting your vitamin levels checked. Now I want to ask you, how often do you walk each day? Are you getting at least 20-30 minutes of movement? Let me know in the comments, because this is one of the simplest but most powerful things you can do. Listen, I know leg pain at night can feel exhausting, frustrating, and scary. I know there are nights when you just want to sleep peacefully without waking up in pain, and you deserve that. But here's what I need you to understand: your body is not broken. It's not giving up on you, it's actually trying to protect you. Every ache, every tingle, every cramp is a message. and now you know how to read those messages. You know the 5 serious warnings, you know the mistakes to avoid, and you know the solutions that can help you feel better and stay safe. This is not about fear, this is about empowerment. This is about taking control of your health so you can live the life you want to live. You don't have to suffer in silence, you don't have to accept pain as just part of getting older, you can take action, you can get help, and you can feel better. If this video helped you, please hit that like button, share it with someone who needs to hear this, and if you haven't subscribed yet, do it now because I'm here every week giving you the health information that actually matters. Drop a comment below and let me know which of these 5 warnings resonated with you the most. Have you experienced any of these symptoms? Your story could help someone else feel less alone. And remember, your health is your wealth. Protect it, prioritize it, you're worth it. I'll see you in the next video. Take care of yourself.